Hello, and welcome to Connected with Latham, where we discuss ideas, legal developments, and business trends shaping the global economy. This is the seventh episode of the Latham and Watkins Drug Pricing Series, and I'm Chris Schott, a partner in the healthcare and life sciences practice in our Washington, D.C. office. I focus my practice on manufacturer compliance related to the Medicaid Drug Rebate Program, Medicare, and the 340B Drug Pricing Program. Joining me is Danny Machado, an associate in our Washington, D.C. office.
Thanks, Chris. I'm excited for our chat, as always.
Thank you for joining. In each episode, we focus on a specific drug pricing topic, and after discussing the substance, we ask the question, which Olympic sport is it like? And we have the list of Olympic sports here to see which most resembles the topic in terms of strategy, complexity, or, frankly, level of conflict. Danny, what is our topic for today?
The topic for today, drug pricing outlook for 2024. So a sort of look ahead at what's to come.
Yeah, and this was also the subject of a Bloomberg article that we authored, which is linked in the show description. So today's episode will be a lightning round where we basically bounce back and forth and run through the topics that will likely be significant for the drug industry in 2024. To start off with, it's pretty clear that the pressures and uncertainties that the pharmaceutical industry faced in 2023 will likely continue in 2024 as well. And of course, some highlights we'll touch on is implementation of the Inflation Reduction Act at the federal level, activity at the state level, where the states are continuing to aggressively look at drug pricing. And then, of course, we've seen a greater willingness from manufacturers to challenge government overreach in court. And that's also something that will likely continue into 2024 when there will be even greater scrutiny as a result of the election and campaign cycle.
Yeah, so the first topic that we want to sort of talk about front and center last year and into the next year is how CMS began implementing the Inflation Reduction Act's Medicare price control program in 2023. CMS selected the first drugs that are subject to forced negotiation. This was in April 29 of 2023. And we're looking forward to September of 2024 when CMS is going to publish those maximum fair prices for these drugs. In 2023, we also saw that CMS published revised guidance to implement this program. And we really saw CMS take aggressive positions in how it interpreted certain parts of the statute, for instance, the definition of drugs. And we've commented on this before. But one of the things that we noticed in evaluating the impact of the IRA was the impact to stock prices. So right after CMS selected drugs in August 29 of 2023, and interestingly, we took a look at the stock prices of the selected manufacturers right after CMS published those selected drugs, and we didn't see too much of an impact. So this is something that remains to be seen, and we're curious to see what happens in 2024.
Yeah, and then multiple manufacturers, of course, also have challenged the IRA in court, largely on constitutional grounds. We expect that litigation to continue in 2024, and it's likely that these constitutional challenges will be supplemented with more as-applied type challenges as the IRA begins to have real-world impacts on the industry.
And another piece of the IRA, of course, Chris, the Part D redesign, which kind of modifies the liability for both Part D plans and drug manufacturers starting in 2025 and reduces the Medicare's liability for spending above a certain out-of-pocket cap. It'll be important to track what CMS does with this. CMS recently published revised guidance for this program. And especially for manufacturers that may qualify for certain of the phase-ins, it will be interesting to keep an eye on what happens.
And we also saw in 2023 that this new IRA authority, which is limited to the Medicare program, seems to have stimulated or motivated CMS to look for greater authority in the Medicaid program as well. And so we saw a proposed regulation come out in May of 2023 that, among other things, proposes CMS issuing what amounts to a shame list of the most expensive Medicaid drugs. Most recently, that regulation has appeared on the OMB's website with an action date of June 2024. So it's unclear how the election cycle will impact CMS's decision when to publish, whether to publish, but this is definitely one that we should track.
Absolutely, Chris. And switching gears a little bit, we talked about the IRA quite a bit, but the 340B program also saw some activity this year. We saw very recently that there was a court in South Carolina that invalidated the program's longstanding patient definition. And we've also seen that courts are continuously evaluating the contract pharmacy policy issue in 340B, and some manufacturer challenges continue into 2024.
And states have shown an increased interest in the 340B program, especially the contract pharmacy issue that you mentioned. And with some states, for example, Arkansas, having adopted state laws trying to mandate contract pharmacy in 340B. And so all these laws have been challenged in court on preemption and other constitutional grounds. And these lawsuits also are likely to continue into 2024. But the states are also pushing their own drug pricing initiatives. So, one thing we're seeing is progressing from the so called transparency laws to more actual price controls, such as in Colorado with the Prescription Drug Affordability Review Board, or PDAP. While these initiatives seem to be focused at the state levels, they could indirectly impact federal programs. So stay tuned for more likely legal challenges against those regimes as well.
Absolutely, absolutely interesting at the state level. And then some other policy trends outside of what we've talked about, Chris. For instance, one that seems to be gaining some traction is the idea that reimbursement levels should be set not at the particular drug level, but more across a therapeutic class. And also the idea that international reference pricing should be the way that we look at drug pricing. And in the first iterations of the IRA, before it became law, that was one of the ways that the prices would have been capped. So it's interesting to see that. And these themes, they continue to emerge. They're political issues because Democrats have taken certain positions and Republicans have taken certain positions, but there still seems to be bipartisan support for even some of the more aggressive policies, which is interesting. It remains to be seen what will happen with the November 2024 election, presidential election, and that may determine which path the US continues to move in, whether it continues to move in the path that we've been seeing recently, a more European style model with price controls, or if it moves back to more of a free market economy.
Yeah, and how do we respond to all these developments at the federal level, the state level, litigation that's ongoing? So definitely one challenge for manufacturers is to track all this, to be aware of it. But these challenges also bring opportunities. And so what it really takes here in response is to have a well-rounded team of not just business leaders, but also internal and external experts who can help formulate the commercial strategy that will actually maximize patient access and foster therapeutic innovation, because that essentially is the goal that we have, and that's been the hallmark of the pharmaceutical industry. And having a team in place that tracks developments, that's able to respond strategically, is going to be the key again in 2024.
Yeah, so it's probably fair to say our takeaway here is that we got to put our seatbelts on and settle in for 2024 because it's about to be a pretty wild ride.
I think that nicely sums it up, and especially with the election, if nothing else, it'll inject more excitement into this entire field. So, with that, let's ask the question: which Olympic sport is it like? Danny, what did you think?
Oh, well, Chris, after going through all of those different topics, my mind goes to marathon swimming. Think of it as this is where an athlete takes on a 10-kilometer course and it's an open water environment. So it's like an open water, like the sea, a river, a lake. It really tests the athlete's mental strength and tactical ability. It's a lot of physical endurance that's needed. You got to adjust to changing currents. In a way, I view this as what's going on with pharmaceutical manufacturers and the different policies and implementation of different programs that we've been seeing this year. You got to keep up with the times. There are changing currents, and you just have to stay on course.
Very interesting. I see it more as a struggle of sort of different teams, which is why I went with flag football, which is kind of like American football, but it takes out the tackling, and all you have to do is just kind of capture the flags from the other players, which makes it seem like it's kind of benign and we're not really punching people. But we know behind the scenes, what's at stake is winning the game, right? And so it strikes me that here it's kind of similar. We're playing games in court, we are having other battlefields in Congress, we are having policy debates, but behind all this are really important interests and preserving the innovation engine, which is the American pharmaceutical industry. So I think with that, Danny, where are we going? Where's the after party?
I think it's time for an after party, Chris. And I thought today we could go to a new cocktail bar that just opened right next to its sister restaurant, Maiden, and it's called Medina. And Medina's a small, kind of cozy bar. It's very lushly decorated. Great drinks, and maybe we can grab a bite at Maiden right after.
That sounds like an excellent choice. Can't wait to check it out. Thanks to Danny for joining me as a moderator, and thank you to our listeners for checking out the Latham & Watkins Drug Pricing Series, which is part of our Connected with Latham podcast. You can subscribe and listen to new and archived episodes of Latham's podcasts on lw.com, Apple Podcasts, Google Podcasts, Spotify, or anywhere else you listen to podcasts. If you have questions or would like additional information, please email us using the links located in the show description. We hope you'll join us again next time.
This podcast is provided as a service of Latham & Watkins LLP. Listening to this podcast does not create an attorney-client relationship between you and Latham & Watkins LLP, and you should not send confidential information to Latham & Watkins LLP. While we make every effort to assure that the content of this podcast is accurate, comprehensive, and current, we do not warrant or guarantee any of those things. And you may not rely on this podcast as a substitute for legal research and/or consulting a qualified attorney. Listening to this podcast is not a substitute for engaging a lawyer to advise you on your individual needs. Should you require legal advice on the issues covered in this podcast, please consult a qualified attorney. Under New York's Code of Professional Responsibility, portions of this communication contain attorney advertising. Prior results do not guarantee a similar outcome. Results depend upon a variety of factors unique to each representation. Please direct all inquiries regarding the conduct of Latham & Watkins attorneys under the New York's disciplinary rules to Latham & Watkins LLP, 1271 Avenue of the Americas, New York, New York, 10020. Phone number 1-212-906-1200.